Welcome to another episode of Med Madness, your ultimate guide to mastering medical knowledge for the USMLE. Today, we will discuss an important topic that often raises concerns among postmenopausal women, postmenopausal bleeding or PMB. We'll cover the approach to diagnosis and management, ensuring you understand the crucial steps in evaluating this condition. Let's dive in. Postmenopausal bleeding is defined as any vaginal bleeding that occurs after a woman has reached menopause. While the majority of cases are benign, PMB can sometimes indicate serious conditions such as endometrial cancer. Today we'll break down the evaluation process for PMB, focusing on the use of transvaginal ultrasound or TVUS and endometrial biopsy. Now let's consider a real-life scenario. Mrs. Johnson, a 62-year-old woman, noticed light vaginal spotting 4 years after her last menstrual period. Concerned, she visited her gynecologist. The doctor performed a transvaginal ultrasound which revealed an endometrial thickness of 6 millimeters. Due to this finding, an endometrial biopsy was performed, which unfortunately showed atypical hyperplasia. Mrs. Johnson underwent a hysterectomy and is now in good health, free from symptoms. When a postmenopausal woman presents with vaginal bleeding, it is essential to evaluate the endometrial lining. There are two primary methods used for this evaluation: transvaginal ultrasound, or TVUS, and endometrial biopsy. TVUS is often the first step due to its non-invasive nature. It helps measure the thickness of the endometrium. In postmenopausal women, a normal endometrial thickness is 4 millimeters or less. If the endometrial thickness is 4 millimeters or less, no further evaluation is typically needed. If the endometrial thickness exceeds 4 millimeters, an endometrial biopsy is necessary to rule out malignancy. An endometrial biopsy is considered the gold standard for diagnosing endometrial cancer. This procedure is more invasive but offers high sensitivity and specificity. In summary, postmenopausal bleeding is a critical symptom that warrants careful evaluation. TVUS is an excellent initial step, and an endometrial biopsy is necessary for those with an endometrial thickness greater than 4 millimeters. Effective management depends on the biopsy results, with options ranging from observation to surgery. Remember, engaging with our pre- and post-podcast quizzes, along with Anki flashcards, can reinforce your understanding and help retain this important information. Thank you for listening to Med Madness. Stay curious, stay informed, and let's ace the USMLE together. Next, let's discuss management. Once the evaluation is complete, management depends on the biopsy results. If the findings are benign, observation is generally recommended. However, if atypia or neoplasia is detected, treatment options may include progestins or surgery. For example, a woman with atypical hyperplasia or endometrial cancer might require a hysterectomy with bilateral salpingo-oophorectomy, which involves the removal of the uterus and both ovaries.